If you or someone you love is going through lung cancer treatment, you're probably always thinking about ways to improve the odds and, just improve life along the way. So in this explainer, we're going to dig into some of the latest research on supportive care. We'll explore what the science says about adding things to your standard treatments to get the best possible outcome.
This is the big question, isn't it? If you're watching this, you want to know how you can be an active, informed partner in your own care. And that's exactly what this is all about, exploring the evidence to see what might be possible.
Okay, so let's be absolutely crystal clear about something. What we're about to cover is for your information. It's a tool, not medical advice. The whole goal here is to arm you with research so you can have a really productive, empowered conversation with your oncologist. It's all about building a plan together that supports and never, ever replaces your standard medical care.
To really see what this new frontier of care looks like, we're going to put a spotlight on 3 pretty compelling examples from recent scientific studies. And these are areas where the data is pointing to some really significant and, in some cases, pretty surprising findings.
First up, something you can find in pretty much any medicine cabinet, antihistamines. Now, this is where it gets fascinating. Recent research looking at patients on immunotherapy has found a huge difference in how different types of these common drugs seem to work with the treatment.
And wow, the findings here are just stark. Researchers saw this massive split. Common allergy pills, the ones we call H1 antihistamines, were linked to better survival for patients. But on the other hand, certain heartburn drugs, which are H2 antihistamines, actually showed the opposite. They were linked to worse outcomes. It's just a powerful reminder that not all antihistamines are the same at all.
So, just how big was this benefit? Well, the data showed that using these H1 antihistamines was linked to an 80% longer treatment response. To put it simply, the immunotherapy just seemed to work better for a much longer time.
And let's put that in more personal terms, right? Patients who were taking H1 antihistamines had, on average, 3 times longer progression-free survival. That means 3 times as much time without the cancer clearly advancing. And that, right there, that statistic represents more time and a better quality of life.
Okay, now let's turn to another really common medication that's showing some unexpected benefits. We're talking about statins, the drugs that are usually prescribed to lower cholesterol. Well, it turns out multiple large-scale analyses are now connecting them with improved cancer outcomes too.
So a huge analysis back in 2022 looked at almost 300,000 patient records, and it pointed to one statin in particular, atorvastatin. It was linked to a 59% improvement in treatment response. Now, this suggests the statin isn't just doing its own thing, it might actually be making the cancer therapy more effective.
So let's kind of break down the key findings here. First, the risk reductions they saw often fell somewhere between 30 and 60%. The 2 standouts were atorvastatin and another one, lovastatin, which you might actually know as the active compound in red yeast rice. What's really interesting is that the benefits seem to be the biggest for what they called cholesterol responders. Basically, the people whose cholesterol dropped the most from the statin also got the biggest cancer-fighting boost. And to top it off, some data suggests the effects are even stronger when you combine it with low-dose aspirin.
All right, for our third and final spotlight, we're going to switch gears to a well-known herbal supplement, Astragalus. A really remarkable study in 2021, which was part of a big effort by the Turkish National Health Authority, looked at its impact on patients getting chemotherapy or targeted therapy.
The finding was just so direct and powerful. The study reported that for patients on chemo or a targeted drug called erlotinib, adding Astragalus doubled their survival time. Just let that sink in for a second. The results were so positive, the supplement is now officially recommended by the Turkish Health Authority for these patients. Doubled.
So, it seems like Astragalus is a real triple threat. First, the survival benefit it gave was on par with adding a powerful immunotherapy drug. Second, it seems to help rebalance the immune system while you're getting treatment. And third, and this is a big one, a separate analysis found it cut the rate of serious side effects like neutropenia, that's a dangerous drop in white blood cells, in half. So it makes the treatment not just more effective, but also a whole lot more tolerable.
Now, here is a crucial piece of safety information. Because of how it works on the immune system, Astragalus could be dangerous for anyone who's had an organ transplant. This is the perfect example of why every single thing we've talked about has to be cleared with your doctor first, no exceptions. So these 3 spotlights are pretty incredible, right? But believe me, they are just the tip of the iceberg. The body of research into this kind of supportive care is just vast, and it's growing all the time, covering dozens of different compounds and approaches.
Just to give you a sense of the scope, take a look at this table. For instance, research on danshen, or red sage, points to risk reductions over 50%, possibly by helping to stop the cancer from spreading. Or look at melatonin taken at night. Studies show it might improve survival and also reduce some of those tough side effects. The list just goes on and on. The key thing to remember is that the research is broad and it points to a lot of potential avenues to explore with your care team.
So the big question is, where do you go from here? The point of all this research isn't just to inform you, it's to empower you for that next conversation you have with your oncologist.
So here's a simple, actionable game plan. First, just review the studies or the areas that really feel like they connect with your specific situation. Second, jot down your notes, get your questions ready. And third, bring all that information to your doctor. The goal here is a partnership, where you work together to build the best, most personalized care plan you possibly can.
We'll just end with this thought. When you're armed with credible research, you have the ability to totally transform your role in your own treatment. So what if that next conversation you have with your doctor was your most powerful one yet? Thanks for joining us.